Bismillahirrahmanirrahim. And quote for the day is Allah says in Holy Quran, by time, indeed mankind is in loss, except for those who have believed and done righteous deeds and advised each other to truth and advised each other to patience. The topic for today's presentation is Introduction to Nutrition, Macro and Micronutrients and Proteins. I am Dr. Ayesha Amin, PGR of FCPS Community Medicine at Institute of Public Health, and I will be presenting this under the kind supervision of my supervisor and teacher, Professor Dr. Saira Afzal, who is the Dean of IPH Lahore. The learning outline for today's presentation would be Introduction to Nutrition, brief introduction to macronutrients and micronutrients, introduction to proteins with the focus on protein energy malnutrition, nutritional programs, recent updates, and multiple choice questions. Learning objectives. By the end of this presentation, the participants would be able to describe the basic concept of nutrition, macro and micronutrients, proteins and their importance, protein energy malnutrition and its prevention, and to be able to answer the multiple choice questions. Introduction. Nutrition may be defined as the science of food and its relationship to health. It is concerned primarily with the part played by nutrients in body growth, development, and maintenance. The word nutrient or food factor is used for specific dietary constituents such as protein, vitamins, and minerals. Diet is the practical application of the principles of nutrition. It includes the planning of meals for the well and the sick. Good nutrition means maintaining a nutritional status that enables us to grow well and enjoy good health. The epidemiological assessment of the nutritional status of communities, nutritional and dietary surveys, nutritional surveillance, nutritional and growth monitoring, nutritional rehabilitation, nutritional indicators, and nutritional interventions, they all are broadly covered under the umbrella of nutritional epidemiology. The classification of foods, the food is basically broadly classified according to three categories. By origin, the food can be animal or plant origin. By chemical composition, it can be protein, carbohydrates, fats, vitamins and minerals. And by nutritive value, it can be cereals, pulses, vegetables, fats and oils, sugars, nuts, and animal food, and fruits also. Classification of nutrients. The nutrients are broadly classified as macronutrients and micronutrients. The macronutrients contains proteins, fats, and carbohydrates, and micronutrient constituents are vitamin and minerals. Macronutrients. These are proteins, fats, and carbohydrates, as we have already discussed, which are often called as the proximate principles because they form the main bulk of food. They contribute to the total energy intake in the following proportions. Proteins, they should be 7 to 15%, fat 10 to 30%, and carbohydrates 65 to 80%. Micronutrients, they are called micronutrients because they are required in small amounts, which may vary from a fraction of milligram to several grams. These includes vitamin and minerals. Coming to the introduction to proteins, the word protein by derivation means that thing which is of prime importance. Proteins are complex organic nitrogenous compounds. They are composed of carbon, hydrogen, oxygen, nitrogen, and sulfur in varying amounts. Protein constitute about 20% of the body weight in an adult. Proteins are made up of smaller units, which is called as amino acids, and there are almost 20 different type of amino acids. Coming to the classification of amino acids, the amino acid can be essential amino acids, which are known as indispensable amino acids because the body cannot synthesize them in amounts corresponding to its needs, and therefore they must be obtained from dietary proteins. They are total 9 in number. Non-essential amino acids, which are also known as dispensable amino acids because the body can synthesize them in amounts corresponding to its needs. They are total 11 in number. This is the list of the essential and non-essential amino acids. The essential amino acids contain arginine, isoleucine, histidine, leucine, methionine, lysine, phenylalanine, tryptophan, and valine, while the non-essential amino acids are alanine, arginine, asparagine, aspartic acid, cysteine, glutamic acid, glycine, proline, serine, and tyrosine. So, what are the biological complete and biological incomplete protein? A protein is said to be biological complete if it contains all the essential amino acids in amounts corresponding to human needs. The quality of dietary protein is closely related to its pattern of amino acids. From the nutritional standpoint, animal proteins are rated superior to vegetable proteins because they are biologically complete. When one or more of the essential amino acids are lacking, the protein is said to be biologically incomplete. So this pie chart is basically showing the proteins in the body. So majority of the proteins, they form the muscle mass of our body, while rest of it is present in bone, skin, and other like blood, glands, and nerve tissue. But the major bulk of protein is present in the form of muscles. Functions of protein. The proteins build and maintain tissues. Protein makes up about 10, 18 to 20% of our body. It is a necessary part of every cell. Skeletal muscle account for more than half of body protein. It makes important compounds like enzymes, hormones, antibodies. It regulates mineral and fluid balance. Proteins help carry the minerals sodium and potassium from one side of the cell wall to the other. Proteins also maintain acid-base balance. The maintenance of the correct level of the acidity of the body fluid. Proteins in the body, they act as a chemical buffer. Carry vital substances. It is used to transport lipoproteins, irons, and other nutrient as well as oxygen, chromosome, and other bundle of proteins to other parts of the cell. Provide energy. It provides the cell with the energy that needed to exist. If carbs and fats are lacking, the body uses protein as an energy source. This is again the slide showing the functions of protein. So it there we have enzymes which are basically protein in nature. Then we have proteins which are used for antibody support. They support muscle contraction again, and they perform the transport function as well. Sources of protein. The sources of protein can be of animal source or the plant origin. The animal source of proteins, the protein of animal origin, they are mainly found in milk, meat, egg, cheese, fish, and fowl. These proteins contain all the essential amino acids in adequate amount. Egg proteins are considered to be the best among food protein because of their high biological value and digestibility. They are used in nutrition studies as reference protein. They're also high in fat, but the protein source, they have no fiber and they are considerably expensive. While the plant source of proteins, the vegetable proteins are found in pulses, that is legumes, cereals, beans, nuts, oil seeds, etc. They are poor in essential amino acids. They are cheap, but they are easily available and they are consumed in bulk. One of the beans known as soybeans is considered to be as the meat alternative. Supplementary actions of proteins, cereal proteins as they are deficient in lysine and threonine, and pulse proteins in methionine, so they are known as limiting amino acids. When two or more of the vegetarian food they are eaten together, their protein supplement on one another and provide a protein comparable to animal protein in respect of essential amino acids. Thus, with proper planning, it is possible for a vegetarian to obtain a high grade protein at low cost from mixed diet of cereals, pulses, and vegetable. This is known as supplementary action of protein, and it is the basis of counseling people to eat mixed diet. Protein requirements. The average requirement for an adult is about 0.8 to 1 gram per kg body weight per day. So for a 60 kg man, it becomes the 60 grams per day, while if a female is 55 grams per day. In pregnancy and lactation, the requirements for protein is increased. In pregnancy, the additional 15 to 25 gram per day of protein is needed, leading to a total intake of 70 to 75 gram per day. While if a woman is lactating, additional 25 gram per day of protein is needed, and it leads to total of 75 to 80 grams per day of protein. Contribution of proteins to energy. The proteins provide 4 kilocalories per gram, and they should supply 10 to 15% of the total daily energy intake. This is the sum of the protein foods and their protein content is given. The lentils have 24 to 25 grams of proteins per 100 grams, while the chickpeas, whether black or white, they gives 19 to 20 grams of proteins. Again, kidney beans, they are the rich source of proteins. Then we have paneer, which gives 18 grams per 100 grams of proteins. The soy, it contains 36 to 52 grams, for which it is considered as an alternative to meal. Then chicken, it gives 31 grams. So we can see that soybean is contains relatively high protein as compared to the chicken. And then we have fish, which contains 20 to 25 grams of protein per 100 grams. This is the healthy eating food pyramid. So we can see that the base of this pyramid is formed by the cereals and vegetables, then fruits and the cereals, which are cereals and flours, which are basically carbs. Then we have fruits and vegetable. Then we have the dairy products and white meat. And the upper part of this food pyramid contains the meat, poultry, dry bean, fish, eggs, and nuts. And we almost need 2 to 3 servings per day of these proteins. Assessment of proteins. The protein assessment is basically done on protein quality and protein quantity. As far as the protein quality is concerned, the quality of protein is assessed by the comparison to the reference protein, which is usually egg protein. Method of assessment of the protein quality are amino acid score. It is a measure of the concentration of each essential amino acid in the test protein expressed as a percentage of that amino acid in the reference protein. Amino acid score. So we can calculate the amino acid score as milligram of amino acid per gram of a test protein. It can be of any food, and we will compare it with the milligram of the same amino acid per gram of the reference protein, which is basically egg is used as a reference protein, and then we multiplied it with the 100. The amino acid score is somewhere between 50 and 60 for starches, and it is 70 to 80 for animal food. The next parameter is net protein utilization, NPU. It is a product of digestibility coefficient and biological value, which is divided by 100. So the NPU gives a more complete expression of protein quality rather than the amino acid score. It is a biological method that requires special laboratory facilities. So NPU can be calculated by nitrogen retained by the body divided by nitrogen intake into 100. So 1 gram of protein is assumed to be equivalent to 6.25 gram of nitrogen. So if the NPU is low, the protein requirement is high, and vice versa. Biological value. The biological value of protein is a measure of how well the body can use a particular protein from diet. It considers the proportion of absorbed protein that is retained for growth and maintenance of the body. BV tells us how efficiently a protein source can be converted into the body tissue and how good it is at meeting our body needs. Protein quality, protein digestibility corrected amino acid score, PDCAS, measure protein quality based on human essential amino acid requirements and our ability to digest it. The test protein is compared to a standard amino acid profile and it is given a score from 0 to 1, with a score of 1 indicating the maximum amino acid digestibility. Evaluation of protein quality with PDCAS approach measures the protein's metabolic effectiveness at a dietary intake that meets minimum requirements. To be considered a high quality or complete protein, a protein must contain all the essential amino acids in the right proportion and they should be easily digestible. For protein quantity, to determine what percent of the energy value is supplied by the protein content of a particular food, protein quantity, protein energy ratio PE is used. So PE, protein energy percent, is calculated as energy from protein divided by total energy in diet into 100. The next concept is about the nitrogen balance. So nitrogen balance is defined as the difference between the nitrogen intake and nitrogen loss from the body. Since proteins contain 16% of the nitrogen, so nitrogen balance reflects protein metabolism. We have negative and positive nitrogen balance. The positive nitrogen balance occurs when the intake is greater than loss. So it indicates tissue building and growth. It is an anabolic condition and it is seen in infancy and childhood, pregnancy, lactation, recovering from illness, and bodybuilding states. While the negative nitrogen balance, in this state, the intake is less than the loss. So it indicates tissue breakdown and a state of catabolism. And it is seen in protein energy malnutrition, starvation, severe infections, trauma, burns, and chronic illnesses. Measurement of protein. The measure of proteins is basically done through the measurement of serum albumin, and the albumin levels, they should be greater than 3.5 gram per DL. So coming to the protein deficiency and overconsumption, the overconsumption is when there are excess protein are taken in the diet. So it can cause liver and kidney problem, produced an overburdens of nitrogen waste. Body must excrete this waste before it builds up to the toxic level. Liver turns nitrogen into the urea for which kidneys are then responsible for excreting it through urine. Extra work on the liver and kidneys, creating stress and aging. Calcium loss, diet high in protein from animals contribute to the calcium loss in bone, and there is excess body fat because the proteins they have high fat content. Protein deficiency. It is a condition in which dietary protein intake is insufficient to meet the body's requirement for growth, repair, and maintenance. It commonly occurs as a part of protein energy malnutrition. So, the general clinical manifestation of the protein deficiency is growth retardation, muscle wasting, edema, hair and skin changes, which leads to the thinning of hair and brittle nails, anemia, increased susceptibility to infection, and delayed wound healing. Well, focus on the protein energy malnutrition. So, according to WHO, PEM is defined as imbalance between the supply of protein and energy and the body's demand to ensure optimal growth and function. It is broadly classified as kwashiorkor and marasmus. So, in kwashiorkor, there is marginal energy but insufficient protein intake. The disease that the first child gets when the new child comes, and insufficient protein and energy intake take place in marasmus. So marasmus means to waste away or dying away. The key differences between the kwashiorkor and marasmus. The picture on the left side is showing a child with marasmus, kwashiorkor, and picture on the right side is showing a children with marasmus. So the key differences are in kwashiorkor, it develops in children whose diets are deficient of proteins, and it occurs in children between 6 months and 3 years of age. The subcutaneous fat is preserved, edema is present, there is enlarged fatty liver, ribs are not very prominent, the child is lethargic. Muscle wasting is mild or absent, and there is poor appetite. While in marasmus, it is due to the deficiency of proteins and calories. It is common in infant under 1 year of age. The subcutaneous fat is not preserved. Edema is absent. There is no fatty liver. The ribs are very prominent. The child is alert and irritable. There is severe muscle wasting, and the child has very good appetite. For the treatment of protein energy malnutrition, according to WHO, it is basically done in 3 phases. The first phase is stabilization phase, which constitute about 7 to 10 days. The objective of this phase is to prevent the mortality and correct the metabolic disturbance. So we need to focus on treatment of hypoglycemia, immediate feeding with the 10% of glucose if the child is unconscious, treat hypothermia to keep the child warm, and give frequent feeds. Manage dehydration. You would Resomal orally or IV fluids only if in case of shock. Correct electrolyte balance. Potassium and magnesium supplement is important, and restrict sodium. Treat infections. The empirical broad spectrum antibiotics are given. Then micronutrient supplementation is important. Vitamin A, multivitamin, and zinc is given. Iron is withheld initially, and it is started once after the stabilization phase is over. The diet is basically focuses on F75 therapeutic milk, which is low protein, low sodium milk, and it is given in small quantities with frequent feeds. The next phase is the transition phase. The prime objective of the transition phase is prepare for the catch-up growth. And in this phase, there is a gradual shift from F75 to F100 food milk. In this phase, we monitor the reduction in edema, and there is appetite is assessed and tolerance is assessed. During the rehabilitation phase, the objective is to rapid weight gain and recovery. So in this phase, the high energy, high protein diet is given. F100 or the ready to use therapeutic food is used in this phase. 5 to 6 feeds per day are given. Iron supplementation is started in this phase. So sensory stimulation and play therapy is initiated, and nutritional counseling are given to the caregivers. Prevention of the protein energy malnutrition. So the primordial prevention focuses on poverty alleviation programs, food security and availability, women empowerment and female education, improved sanitation and safe water supplies, and population stabilization and birth spacing is important. The primary prevention includes the maternal nutrition, adequate balanced diet during pregnancy and lactation, and the regular antenatal care and supplementation. Infant and young child feeding practices. Exclusive breastfeeding should be there for the 6 month, and continued breastfeeding up to 2 years or 2 years only. Timely, adequate, and safe complementary feeding from 6 months with protein-rich food. Nutritional education, promotion of the balanced diet, proteins complementation, that is cereal plus pulses, the combination of food, and appropriate feeding during illness. Immunization is important. Full immunization, especially measles, to prevent infection related to malnutrition, infection prevention, safe water, sanitation, and hygiene practices. Also, deworming of the child is very important, and food security measure access to the adequate quantity and quality of food at household level. The secondary prevention focuses on growth monitoring, in which the height and weight of the child is taken, and also and it is then compared with weight for age and mid upper arm circumference. Early identification of undernutrition, supplementary feeding programs should be started, and again the timely referral is important in case if the child is not improving. In the tertiary prevention, effective treatment of protein allergy, malnutrition, nutritional rehabilitation, prevention of relapse, and psychosocial stimulation. Then the nutritional programs, the government and multi-sectoral programs are National Multi-Sectoral Nutrition Program, a recent 3-year government plan to combat child malnutrition. Then there is Benazir Nishunama Program, which is a World Food Program supported initiative under Benazir Income Support Program to prevent stunting in vulnerable women and young children. Then there is National Zero Hunger Program, which is a joint effort between the government and UN agencies, and Scaling Up Nutrition Movement, that is SUN, network involving government, UN, businesses, and academia to streamline nutritional efforts. Then international and NGO events, the Nutrition International works on multiple micronutrient supplementation, oil fortification, and journal nutrition improvement of mothers and children. There is a World Food Program which supports stunting prevention, fortified floors, school programs, and resilience building. UNICEF focuses on child survival and development, supporting government priorities in nutrition, health, and WASH. And World Bank supports the Enhanced Nutrition of Mothers and Child project to increase intervention coverage for young child and mothers. Coming to the recent update, this is an article which was published in Journal of the American Heart Association. It states the dietary intake of protein by food source and incident hypertension among diverse US adults, the MESA studied. So the background is dietary guidelines are recommended for adequate protein intake from diverse sources for optimal blood pressure. However, its role in hypertension risk remain unclear. So they examined a prospective association of protein intake and diversity overall and by source with hypertension risk in MESA. MESA is basically a multi-ethnic study of atherosclerosis. So in this study, there were 2294 participants, and they interviewed them at the baseline, and their total protein is calculated by a food frequency questionnaire. And in the conclusion, they find out that the higher consumption of and variety of minimally processed plant proteins, they lower the hypertension risk, while the minimally processed animal proteins, they can be included without significantly increasing hypertension risk among middle-aged US adults. So in this study, they basically found out that if the plant protein is taken, there is a minimal risk for hypertension associated with the higher consumption of plant protein. Coming to the multiple choice questions, the first MCQ is a child with marasmus shows severe wasting but no edema. The most appropriate long-term community intervention is A, vitamin A supplementation, B, deworming alone, C, ensuring adequate energy and protein intake, D, iron supplementation, E, salt iodization.
C.
Yes, C is the right answer. The next MCQ is during famine relief, which would a food combination would be most effective to prevent protein energy malnutrition? A, rice alone, B, wheat flour alone, C, fruits only, D, sugar and oil, E, pulse cereal mixture.
E.
Yes, E is the right answer. To prevent the protein energy malnutrition, we will give the combination of foods which are cereal and pulse mixture to accommodate the daily intake. A nutritional program focuses on improving the nitrogen balance in post-operative patient. Which intervention is most appropriate? A, high carbohydrate diet only, B, fat-rich diet, C, adequate calories with high protein, high quality protein, D, vitamin supplementation alone, E, fluid restriction.
C.
Yes, C is the right answer. The next MCQ is a public health nutritionist recommends adding soy to wheat flour in a supplementary feeding program. The primary rationale is A, increased palatability, B, improved biological value of the protein, C, reduced cost, D, increased fiber content, D, increased fat soluble vitamins.
B.
Yes, B is the right answer, improving the biological value of the protein. The fifth MCQ is a community nutrition survey shows children consuming diets adequate in calories but low in proteins. Which indicator would best reflect the early protein deficiency? A, BMI, B, hemoglobin level, C, blood glucose, D, serum albumin, E, serum cholesterol.
A.
No, the right answer is D, serum albumin. The sixth MCQ is a 3-year-old child with edema, moon face, and flaky vein dermatitis is diagnosed with kwashiorkor. Which dietary error most likely lead to this condition? A, low carbohydrate intake, B, excess fat intake, C, adequate calories but insufficient protein, D, vitamin deficiency, E, excess salt intake.
C.
Yes, C is the right answer. Adequate calories but insufficient protein, which is the prime defect in kwashiorkor. The next MCQ is a policymaker wants to improve protein intake in rural population using cost-effective measures. The best strategy is A, importing animal protein, B, protein supplements for all, C, promotion of pulse cultivation and consumption, D, hospital-based nutrition therapy, E, exclusive milk distribution.
C.
The right answer is C, promotion of pulse cultivation and consumption. A school launches a program provide rice, vegetables, and oils but exclude pulses. Which nutritional gap is most likely? A, vitamin deficiency, B, mineral deficiency, C, fat deficiency, D, excess calories, E, protein inadequacy.
E.
Yes, E is the right answer. The ninth MCQ is a community survey shows adequate protein intake but high prevalence of protein energy malnutrition. The most plausible explanation is inadequate total energy intake, B, low carbohydrate intake, C, excess fat intake, D, high fiber intake, E, excess vitamin intake.
A.
Yes, inadequate total energy intake. The last MCQ is which protein quality indicator best reflect the ability of a protein to meet human amino acids need? A, protein content, B, net protein utilization, C, biological value, D, digestibility coefficient, E, nitrogen balance.
B.
No, the right answer is C, biological value. This is the key to MCQs. These are the references which have been used in this presentation. This is the official channel of the Institute of Public Health where the recording of this presentation will be uploaded. And thank you.
Thank you so much. It was very informative.
Thank you, Dr. Amna.